They say the eyes are the windows to the soul, but what happens if those windows become dry, blurry, or even worse, they stop working altogether? Vision is arguably the most important of our five senses, and yet most of us take our eyes for granted until something goes wrong. Dr. Madeline Camejo, Chief Pharmacy Officer at Baptist Health, and Dr. Beatriz Jimenez-Cadilla, Ambulatory Clinical Specialist at Baptist Health, are here to help us better understand the importance of ocular health, as well as answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
I'm Kathy Buccio, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from one of our viewers. Our first question comes from Vincenzo, who reached out to us via our website, allhealthtv.com. And Vincenzo's question is, hey doc, my wife Francesca has diabetes and her endocrinologist sent us to an ophthalmologist because she's been having blurry vision and difficulty seeing at night. The opto diagnosed her with diabetic retinopathy and has prescribed anti-VEGF injections. What the heck is VEGF, and can you explain what these medications do exactly? Well, Dr. Camejo, I didn't know that diabetes could have a negative effect on our eyes. So this is new information. Please tell us a little more about that.
Sure, Kathy. Actually, if left unchecked, diabetes can actually hurt your eyes, and you can lose your vision. It's a pretty nasty disease. So hi, Vincenzo, thanks for reaching out, and I'm pretty happy to give you the 411 on these. Now, there are several drugs that have come to market, like Avastin, Lucentis, and even Eylea. You'll see the commercials for them. And these are called, these are all in a class of drugs. They're called anti-VEGF because they're eye injections to treat conditions that cause an abnormal blood vessel growth. Now, these anti-VEGF drugs actually block the production of vascular endothelial growth factors, and that's why it's called VEGF. It's a protein that causes blood vessels to leak or grow abnormally. So the injections do what they do is they shrink that abnormal blood vessel and reduce the swelling in the retina, and this helps limit the vision loss in our eyes.
Thank you for that, Dr. Camejo. And heads up, docs, we have another YouTube question from Ariana. Ariana asks, hello, Dr. Camejo. I have a form of glaucoma known as angle closure. Anyway, the ophthalmologist just prescribed a number of medications for the various symptoms I'm having. What can you tell me about prostaglandin analogs, beta blockers, alpha agonists, and carbon anhydrase inhibitors? Well, first of all, I hope I said that all right. That was a mouthful. Dr. C and JC, what is glaucoma exactly? And is it normal to prescribe so many medications for one particular disease? And I think all of us probably know someone who has glaucoma in our own families.
Absolutely, Kathy. You and Ariana are both asking important and completely understandable questions. But I'm going to let Dr. Jimenez take this one.
Yes. So I can empathize with our viewers out there that have been diagnosed with glaucoma, because my dad actually has glaucoma and had to go through surgery, and we had to take care of him for over 2 weeks, putting his eye drops right on time. So it definitely can be a disease that can impact quality of life, and having the support system there for you to help you get through it is definitely important. So glaucoma is an eye disease that damages the optic nerve. And the optic nerve is responsible for carrying visual information from the eye to the brain. So this eye disease is usually caused because of abnormal increased pressure in the eyes. And there are two types of glaucomas. There's open angle and then there's closed angle glaucoma. So depending on the type, they will use different medications to treat it. Specifically, they're going to use eye drops to treat the glaucoma. So going over the different types, there's prostaglandin analogs. These are going to increase the amount of fluid that drains through the drainage canals in your eyes, and it's going to ease that pressure inside the eyes. So examples of that can be Lumigan, latanoprost, which is also known as Salatan, or tafluprost, which is Cyoptem. And then there's also travoprost and Travatan Z. Then we also have beta blockers. These are going to lower that amount of fluid in the eyes, and thereby it's going to be reducing that pressure. So examples of that is betaxolol, which is betotoptic, and there's also timolol. That one is timoptic or betimolol. We also have alpha adrenergic agonists. These help drainage, and they also lessen the amount of fluid that the eye makes. So examples of that can be iopodine, which is also apraclonidine. There's also brimonidine, which is alphagan. And then we also have the carbonic anhydrase inhibitors. These are less commonly used, but they help curb the production of the fluid in the eye. So examples of that is going to be ASOP or brinzolamide, and then there's also dorzolamide or trusopop. We also have combination medications of these eye drops. So these are going to help save time and money, and it's all going to help with adherence. Because let me tell you, my dad is the first one that struggled with adherence. We had to have like alarms, etc., to remind him to take it, because a lot of these medications you have to take 2 to 3 times a day. So examples of these combo meds can be timolol and dorzolamide, which is COSUP. This one's, I think it's my dad has been on this one before. And then brimonidine and timolol, which is Combigan. Lastly, we have the cholinergic agents, and they're rarely used for glaucoma. These drops help your eye make more fluid and drain more liquid by making the pupil smaller. And an example of that can be pilocarpine. So that's also known as carpine and isopto. So if these eye drops don't work, then your doctor may prescribe medications like pills that you take by mouth. And the examples of that can be acetozolamide or Diamox or oh gosh, I'm not going to be able to say this one right, but I'm going to try methazolamide or neptazane.
Such great information, Dr. Jimenez. Thank you for sharing that and all the different possibilities that we can use to treat glaucoma. I have a question though. How early should you be checking your ocular health for these diseases like, let's say, a glaucoma or cataracts? How early does that start?
Yeah, can I take this one actually, Dr. Camejo?
Sure.
So if you have a family history of people that already have eye issues, for sure, you would need to get an eye exam sooner than anyone else recommended. Also, if you have diabetes, if you're diagnosed with specific conditions that can affect the eye, or those conditions can be complications, can have complications in the eye, like high blood pressure, etc., then it's recommended that you get these eye exams done annually. So as soon as you're diagnosed, you're going to have, your doctor's going to be sending you a couple of labs and diagnostic exams, etc., that should be done. So if you have diabetes, you should get those an eye exam done at least annually. Same thing with hypertension or high blood pressure. And if you have a family history, or you're already starting to experience some vision changes, definitely that's a sign for you to go and see a doctor.
Thank you, Dr. Jimenez. Very helpful. Now we have another All Health TV question. This one is from Darius, who asks, Dr. Camejo, I've had frequent changes to my prescription glasses over the past few years and a sensitivity to light. So I finally went to an ophthalmologist who says I have cataracts. He suggested surgery, but since I am in no rush to go under the knife, he said I could try prescription eye drops and antioxidant supplements. They won't reverse the condition, but they could possibly slow cataract formation. What can you tell me about these drops and these supplements? This is a really interesting question. Please tell us more about the drops and the supplements. Obviously, we hear the term cataracts. I just asked Dr. Jimenez as well. So can you explain, first of all, a little bit what cataract is, Dr. Camejo, and then what these drops and these supplements do?
Sure. So usually cataracts is a protein that kind of builds over your eyelid, and you start to see very cloudy, and it's very difficult for you to see. Now, there is no drug currently that will eliminate cataracts. You know, the only way you can do that is through surgery. where the surgeon actually
Right.
replaces that lens in your eye. But there are a few over-the-counter drops that could help relieve the symptoms of dry eye, because with people with cataracts usually have a lot of dry eye, like Sustain or Lenesterol. Now you can get those at your local pharmacy. Now, as far as supplements, you know, there's been studies out there, you know, studies have linked higher intake of vitamin E, lutein, as well as like long-term vitamin C supplementation can lower the risk of cataracts. Now, there are many good eye supplements out there that are available over the counter. One of them that I like to tell my patients to get is really the Persevisions, the ARDs. Those are great for eye health. And even if you have, you know, as you're getting older, you know, everything starts to break down. It's not like, you know, when you get a new car, everything works great, but over time, things start to fall apart. I think it's really important that you see a doctor. Eye vision is really important, and really start taking vitamins. They're always, eye vitamins are great in for the long term for your eye health as we get older.
Thank you, Dr. Camejo. Does that go for all car makes and models, Dr. Camejo? Do
Pretty
they all
much.
break down?
It all breaks down after years.
All right, well, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We got so many great questions, and we have another one from our YouTube channel. And very naturally inquisitive Blanche wants to know, doctors, I'm not a big fan of taking prescription medications. Having said that, I'd like to know if there are any natural remedies for dry eye syndrome. Okay, all natural. I like this question. Are there some options for Blanche?
And now, Blanche, that's a really good question, and thanks for reaching out. But yeah, there are some home remedies that you can do to help with eye dryness. You know, warm compresses, you know, applying a compress to your eyes to help loosen clogged oils or glandulins along the eyelid. You know, that can really improve tear quality and reduce the dryness. You know, a lot of things that you could do is blink more often. You know, staring at a computer screen does reduce the number of times you blink per minute. So try blinking more often and follow the 20-20 rule, which is like close your eyes every 20 minutes for at least 20 seconds. Now, eating omega fatty acids, foods rich in those, such as like salmon, tuna, walnuts, all of this really helps improve function of oil-making glands in your eyes. The other thing is definitely stay hydrated. People don't drink enough water, you know, throughout the day. So this really helps maintain moisture balance in your eyes, believe it or not. Another thing you could do is use a humidifier, adding moisture to the air, which a humidifier can help prevent your eyes from drying out. And especially in dry or air conditioning environments, it's really important to, you know, give you some moisturizer in the air. And then limit your time screen. You know, reducing the amount of time you spend in front of a screen can also help alleviate those dry eye symptoms. And take frequent breaks and adjust your screen to be below eye level to help reduce those tear evaporations. Now, among those who don't mind taking prescription medications, we do have some great options that we can go over. And I'll let Dr. Jimenez tell us about that for our viewers.
Absolutely. So Mievo is the new kid on the block, which is a prescription eye drop that's used to treat signs and symptoms of dry eye diseases. And it contains a compound that's called perfluohexyloctane. And that is a semi-fluorinated alkane that works to stabilize the tear film on the surface of the eye. And so that is going to prevent the excessive tear evaporation. There's also Restasis, so that's cyclosporin, that's an ophthalmic, so an eye drop. And this medication helps to increase tear production as well as reduce the inflammation in the eyes. There's also the Cedra. That's also an eye drop. The generic name is Lifitegrast. And this one works by reducing the inflammation and improving tear production too. There's another version of cyclosporin that's an eye drop that goes by the brand of Sequa. And that one is very similar to Restasis because it helps with the tear production and also helps with reducing the inflammation. There's also varenicline that's systemic, so you take it by mouth. The brand name for that is called Tyrvaya, and this one is actually is not taken by mouth. It's a nasal spray, and it increases the tear production by stimulating the trigeminal nerve that's in the nose. So the last one that comes into mind is loteprednol, and that one's also an eye drop. It goes by the name of Asubis, and it's a corticosteroid eye drop that helps with reducing the inflammation and also provides some relief from dry eye symptoms.
Thank you, Dr. Jimenez. You deserve an honorable mention for all those, all that pronunciation. Thank you for that. And one more question for Dr. Jimenez, Dr. Camejo. So many of us go to the pharmacy or, and just pick up something for your dry eye, something that's over the counter. Are those recommended?
Yeah, you can actually use them and, talk to the pharmacist at the counter. If you're not sure what are your symptoms, because a lot of times, what is causing dry eye? Is it itchy? Are you having an allergy, reaction? There are different reasons to why your eyes get dry. So, go up to the pharmacist. It's always great. And they love to answer those questions and have them recommend what eye drop to get for you. If you've been up studying all night looking at a screen, it might be good to look at getting Visine for red eye. Now
I have it right here, Dr.
There you
Camejo.
go. And then
a little eye drop right next to me.
There you go. But if you wear contacts and your eyes are getting dried a lot, that could be the reason. Then you might want to, get an eye lubricant. So those are the things that you really need to figure out what's causing that dryness. And, talking to the pharmacist is always great. They love to answer questions.
Thank you so much. Okay, we got another YouTube question. This time it's from Gibby. And Gibby asks, doctors, my brother was diagnosed with age-related macular degeneration, and I've started seeing commercials about it on television. Please tell me what kind of treatment is involved. I know macular degeneration is a serious condition, but I don't understand it really well. I don't understand who it affects the most. So can you let us know, Dr. Camejo, what that is and who's more at risk for macular degeneration?
So, Kathy, it can be a very serious disease, but there are medications that help macular degeneration now. Folks, I would say about 10 years ago, didn't have a way to get treated for these. They kept losing their vision over time. And if you think of macular degeneration, what happens to people, if you take your hand and you just start to close what happened is they tend to really close in and their vision narrows to where it's through a pin because they're losing the things in the retina. So there are two types of AMD. One is wet AMD and the other is dry AMD. Now, dry AMD is the most common form, which accounts for about 80% of AMD. And it usually occurs when parts of the macula get thinner with age. And there's tiny clumps of protein called dussin. They grow. And then people with dry AMD may have pigment abnormalities or graphic atrophy, which is an area of cell loss in the retina. And vision loss is usually gradual. And that's why I say that pinhole effect. Now, treatment options usually require that they usually want you to have vitamin supplements like high dose formulations of anti-vitamin oxidants, like minerals and the ARDs, those perservations that we talked about earlier. Those really do help reduce the vision loss for people with intermediate or advanced dry AMD. The other thing you could look at is like a healthy lifestyle. Avoid smoking because smoking is one of the biggest causes and accelerates AMD. And then there are two new FDA-approved meds, Cyferir and Izervay. You've seen those commercials. Now, these really do help protect the retina from further damage. Now, wet AMD is a form that is less common, but it's really more severe. And it occurs when new abnormal blood vessels grow under the retina. And now these vessels may leak blood or other fluids and cause scarring of the macula. And so the vision loss is usually faster with wet AMD than dry AMD. And this is where we start to use the anti-VEGF injections that we talked earlier. Now, these medications do block that abnormal growth in the vessels in the eyes, and they usually include like Eylea, Avastin, Beovu, and Lucentis. Those are kind of injections that are typically administered monthly or bi-monthly for several months. There's other stuff that you can talk to your optometrist, actually your ophthalmologist with, which is photodynamic therapy. Now, this treatment involves injecting a light-sensitive drug into the bloodstream, which then is activated by laser to destroy those abnormal blood vessels. And then there's laser photocoagulation. Now, this procedure uses a high-energy laser beam to seal off those abnormal blood vessels, preventing further leakage and damage. But you really need to talk to your retina specialist, your ophthalmologist, and see which treatment really is right for you.
Thank you, Dr. Camejo. Dr. Jimenez, this next Facebook question is from Aaliyah, and she wants to know, hello, Dr. Jimenez, I just have one basic question for you today. What are the most common eye drops to stop redness in the eyes? You know, it is a pretty basic question, but nothing's basic. And I honestly think this is a great question because when you go to a pharmacy, there are so many different types of drops, you don't even know where to begin. So this is very helpful. Dr. Jimenez, please take it away.
That's actually that's an excellent point. I even myself get overwhelmed when I go to the pharmacy and I try to get an eye drop for my dogs because they just woke up with red eyes. So it happens to me all the time. I have 4 dogs, by the way. And 2 of them are always like randomly getting their eyes red. And I'm like, what is going on? So I use eye wash on them to make sure that maybe there's no weird stuff in their eyes that we just need to clear out. And usually that does the job, but my veterinarian has prescribed some like anti-inflammatory with antibiotic things if it doesn't improve with just the eye wash. But there are so many products out there that are eye wash, there's eye lubricant. So I can understand if someone goes to the pharmacy and feels as overwhelmed as I have. But the most common eye drops that I see for redness relief is Lumify. So that one is called Lumify Redness Eye Reliever. Those eye drops work very quickly and they reduce the wetness in about 1 minute and it can last up to 8 hours. There's also the Bisign Eye Comfort. This one is also a very well-known brand. And then there's also Clear Eyes Redness Relief. And that one reduces the redness and also has that soothing effect if you have some inflammation that goes with that eye redness.
Thank you, Dr. Jimenez. I know that Visine is probably a household name for so many families at this point. So it's so well known. So thank you. Okay, Dr. Camejo, we got another question from you too, from the tube. It's from Hernando, who asks, hello, Dr. Camejo. There are so many types of eye medications available. Could you provide us with a breakdown of which ones are used for specific eye disorders and conditions? Again, more clarity. I mean, there's never, as much clarity as possible, Dr. Camejo.
Fernando, I'm glad you're asking questions because, again, it is confusing. There's so many eye drops out there, but there's at least 7 types of eye drops you should be familiar with. And I'm just going to make it kind of simple. Let's start with the over-the-counters, right? So like artificial tears, they're also known as the lubricating eye drop. And these are the types of eye drops that help bring moisture to your eyes and reduce that redness as well. Then you have your anti-redness, which is what you have, Kathy, which is kind of like Visine. And these types of drops help to reduce the appearance of redness in your eyes. And then there's the antihistamine eye drops. And these are the types of medication or eye drops that help reduce the symptoms of eye allergies. When you have those itchy, very itchy eyes, those are the types of that you will need to ask the pharmacist, which one is the antihistamine? So those are your over-the-counter, but you're prescribed, and these are the ones that you would need to go see your ophthalmologist for, is usually like an antibiotic. Those eye drops are usually generally to treat bacterial infections in your eyes. So you would need to see what type of bacteria you may have before you're given the exact antibiotic for it. The glaucoma, eye drops that can be used to treat eye conditions like glaucoma to help reduce the pressure in your eye. Those are also prescriptions. Then you have steroidal. Your steroidal eye drops are the types of medications that help reduce inflammation in the eye. And then there's their antiviral. Your antiviral eye drops are the type of eye drops that assist in treating infections that causes virus. So those really, if you understand what are the different, it can kind of help you ask the right questions when you need to from your pharmacist.
Absolutely. Thank you so much, Dr. Camejo. Now, we got time for one more question, but before, in case you missed it the first couple of times, here's yet another chance to find out where we sent in our questions to get answered by these amazing docs.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
This is all the time that we have for today, and so many questions left unanswered, which means we have to come back and answer these. But thank you both to Dr. Jimenez-Cadilla and Dr. Madeline Camejo of Baptist Health for joining us today on Ocular Health. And remember, next time on Ask the Doc, send in your questions so we can get them answered. It's been a pleasure to have you on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.